Well, it's a pleasure to be here at Johns Hopkins today to talk in the symposium on the consequences and costs of mass incarceration in this country. I come from a background myself in working in drug addiction and then AIDS and then prisons, because the people who were drug addicts soon had AIDS, and many of them were spending their time in prison. And as a clinical psychologist and public health professional, I was very determined to stay with this population. And it's been 45 years at this point, and we've learned a lot, and it's important to take the lessons from that experience. The first one was to do with drugs, drug treatment, and the drug issue, and we realized early on that the drug problem, and the war on drugs especially, was associated with the rise of the prison population in this country to record levels. We have 5% of the world's population, but 25% of all the prisoners in the world. And we have the longest terms for prisoners, and this is unprecedented in our history. People have begun to realize the failures of the war on drugs. Indeed, it's collapsing around the ears of many of the people who support it, and that support is diminished now. And more people feel it's been a big mistake, and especially the long mandatory sentences that have filled the prisons. In fact, I would say there's remorse about that at this point, about these long mandatory sentences and all the prisoners that it's produced. Because although there are 2 million people in prison at any given time, that's a very big number of people, the most of any place in the world. There are actually 10 million people who have been in prison in the last 10 years. And because of the way the system works with parole and probation, that's set up to put you back in prison in many cases, the failed urine test, the missed appointment, it becomes very important to change these things. So the idea of drug law reform is something that has been pushed for the last 20 years, really, attempts to change the rules that were putting all these people in prison, and we're having some success with that now. New York State, where I come from, we've reduced the prison population by almost 25% by changing a few drug laws that had mandatory sentences on them. In fact, we realize what's happening now is something we call decarceration, that the curve of incarceration that built up is now peaked off and is going down. And that raises a whole other set of issues. I'm going to mention I was a psychologist in the 1960s at a time when the mental hospitals were being closed. That was the first period of deinstitutionalization. And the lessons we learned from that are very important, because the idea was that these terrible old buildings in the countryside where people languished in their mental illness before drugs were available, back to the images of Bedlam from the 19th century, were not necessary anymore. The medications that were coming online in the 1950s and 60s were effective at treating depression and anxiety and schizophrenia, and we were beginning to use those. And the idea was we wouldn't need these big institutions that were so punitive and so damaging to people, and the stigma of mental illness built around that. And the idea was President Kennedy in 1963 had declared that the Community Mental Health Act, that services would be put in the community to care for these people who were formerly stashed away in hospitals. But that never materialized. This huge population of people, as many as we have in prison now, more in fact, were abandoned. And their families had to deal with them with little in the way of resources to do it. Medicaid and Medicare payments came along, and that helped to enable people to pay for these services, but not nearly enough. And there's been a constant call for parity of mental health services and health services. It will come up again with the Affordable Care Act soon. But another piece of this is continuing to press, not only to change the law so people don't go to prison for offenses that don't bear any danger to public safety, like drugs, but to actually challenging punishment. To have people speak out about the punishments that are overly harsh, and to question the whole premise of punishment itself as an organized institution of the state. We've all been punished. We all know about that. We've all been punished unjustly in our lives. So that's not an alien experience. But when you do that on a scale affecting millions and millions of people, the vast majority of whom are black and Latino in this country, we've given a message that is not in the interest of this nation to have. That is, some people can steal with impunity if they do it through the stock market. Individuals who wind up selling drugs to make a living were subject to the harshest penalties we've ever had in this nation, more severe than for many capital offenses involving the deaths of people. So we're in a position now where the world is changing around us. The war on drugs is collapsing. We're legalizing marijuana state by state. The illicit drugs have actually become a smaller part player in the drama of the health effects of drugs. Overdose death, for example. There are 4 times as many overdose deaths associated with licit pharmaceuticals, the opioids that are prescribed by doctors to people, and they become addicted to them as pain medication and then carry on using them afterwards, often switching to heroin after prescription drugs. So now we have a terrible problem with overdose deaths due to prescription drugs, and we realize that we need to change the rules so they affect all drugs to which people are prone to get addicted. These and other changes are leading to a belief that we have to take apart the prison system, the mass incarceration we have now. President Obama and Attorney General Holder have come out with calls for pardons and redoing sentences of people that are in on long terms in the federal system. But we should realize that most of these prisoners are in state prisons. So it's important to organize at the state level, organize things like restorative justice programs in our own communities, meetings where people with victims and perpetrators meet to resolve things through conflict resolution methods rather than using punishment as the only response to the kind of offenses that always take place in every society. So I am basically optimistic about the direction we're going in now and think it's quite possible that we will be able to get 1 million people out of prison in the next 5 years. Thank you.